So I'm not going to sit here and say DPC is perfect and that there's no problems,
Sure.
but they're my problems. And I have the control to fix them. I am the system. I hated the person that I had become in corporate medicine. It was a very frightening condition to be in. No control over my schedule, no control over where to refer my patients or how much time I got to spend with my patients.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. Welcome back to DPC Life, the podcast where we talk about all things DPC and everything beyond the office. Today I'm talking with Dr. Noemi Adame. She's a pediatrician and founder of Culver Pediatrics Center. She previously worked in corporate pediatric world, but decided to leave when she felt she couldn't practice medicine the way that she felt it should be practiced. And so now she has built her practice around her values. And she left her corporate job when she felt that she could not care for complex children in a system that only gave you 10 to 15 minutes with each patient. So if you're a physician who has felt like you are slowly breaking down within the system, this conversation will show you how one doctor who felt the same way has rebuilt her practice and enjoys practicing medicine again. So let's get into the episode with Dr. Noemi Adame. Today, my guest is Dr. Noemi Adame. She is a pediatrician in Culver, Indiana, and her practice is called Culver Pediatrics Center. And she's also called the Veggies Over Pills doctor. So she'll get into that later, I'm sure. But welcome to the show.
I'm glad to be
here. Yeah, absolutely. So glad to have you. So let's start out. You are a pediatrician, obviously. And tell us how you found DPC.
I started off my first job straight out of residency. I was a hospitalist in San Antonio for about 10 years, and I thrived in that environment. And then we lived out of the country for 2 years, just simply because my husband and I wanted to show our kids a different life than living in a gated community in the San Antonio suburbs. And when it was time to come back, we decided to live in a small town because we had lived in a small town in Costa Rica. And so we wanted to come back to the States, live in a small town. That's how we ended up in Culver. And obviously there was no hospitalist jobs here. So I went into the corporate medicine world, and I just did not thrive in that environment. And it was just and it was the hurry up, you've got 10 minutes to see a patient. And it didn't matter if it was a suicidal 15-year-old or a breastfeeding mom that was crying because she was struggling to get her baby to latch, or a sore throat. And I was so morally injured and distressed. I don't even know how I lasted 5 years, quite honestly. And I think it was just part of that in medicine. You plug along, You're resilient, you're tough, you do it for the patients, right? And somewhere around there was a local doctor, Joel Schumacher, who had opened up his own DPC practice. So I had reached out to him. I didn't really know what DPC was, but honestly, it was to see if he would hire me is why I had reached out. And I feel like he was like my Yoda. He showed me the way of DPC, and I realized that I didn't just hate the doctor I had become in corporate medicine. I hated the person that I had become in corporate medicine. It was a very frightening condition to be in. So I knew I either had to do DPC and open up my own practice so I could practice medicine the way I wanted to, or leave medicine altogether, because I could not continue with a moral injury in the corporate world.
Mm-hmm, mm-hmm. And so that was how long ago?
That was around 2019 when I sat down with him and learned all this. And then I opened up my practice in August of 2020.
Yeah. Wow. Yeah. Great times. Wow. So you are really one of the early PEDS DPCs.
Yeah. When we first, I think there were 12 people in the PEDS DPC group, the Facebook group, when I joined. And now there's 500 or something.
Wow.
The growth has been amazing.
That is great. Yeah. My husband's a pediatrician. And so when we opened, one time I was reading him a note from one of our patients, and it was so sweet. Oh, we spent so much time, and this is the best place I've ever been. It just things that DPC patients say. And he was like, I've never gotten anything like that from my patient. And I've asked him if he wants to join, and he's just set in his ways. He's no way.
And that's great when it can work.
Yes. Yeah, yeah. But I hear so many women talking about, just like you said, the moral injury, and either it's DPC or I'm out, which is terrible.
Right. Because, it's so funny because people keep saying, oh, the system is broken. The system needs to change. As physicians, we have lost control of the system. We don't have control over the system. We can't tell it to change. So I'm not going to sit here and say DPC is perfect and that there's no problems, but they're my problems and I have the control to fix them.
Right.
I am the system.
Yes.
So I have autonomy and I have the freedom to make those changes. And so yeah, I felt very powerless and felt like I had no autonomy. Which again, when you are the most educated person in the room, but somebody else with less training and education is telling you what to do, it is just mind-boggling. So I have no control over my schedule, no control over where to refer my patients or how much time I got to spend with my patients. That was just so distressing for me. When I was a hospitalist, you're in this academic bubble and I could round all day with my residents, right? We took care of sick, complex kids, and we were a tertiary care center and we're an academic center. So, but I could round all day. If I had one patient that I needed to sit down and spend an hour with and dive through the chart and generate a differential, I could do that. You can't do that in the corporate world.
Right.
It's like, click the billable encounter, the CPT code and move on.
Yeah.
I couldn't do that. That just distressed me to know.
Yeah. Back to about the system being broken. You see people talking about kind of the DPC naysayers talking about, well, this is hurting the system, but it bothers me when people try to put all of the problems of the system on DPC doctors. Like, DPC is supposed to fix everything. Well, we know it's not going to, and that's a ridiculous thing to say to people who are trying to make a change. So that's my gripe today. So anyway, you are the Veggies Over Pills doctor. So tell us how you got that name.
So when I was growing up, I told you a little bit, my parents were from Mexico. They were immigrants. I grew up predominantly in a Spanish-speaking household, and we didn't have access to healthcare. So my mother treated us with home remedies at home. And so I entered medical school, I think, with more of an open mind with regards to complementary and alternative. We call it alternative, even though it's been around like much longer, right, than allopathic medicine. And like I went to school at UTMB in Galveston, which was actually, even back then, a kind of like a crunchy, a little more progressive type of school. And so I took courses on holistic, or at that time they called it complementary and alternative medicine. And so I was always very interested in that. But then, of course, you start residency and then you go into the academic world where it's like it's evidence-based or nothing, right? And then the corporate world where maybe it's not as rigid with that regard, but there's no time, right? There's no time to learn or explore all these other things. So when I finally reclaimed my time and my joy and my peace, when I started out my own practice, I started taking all these courses that I could finally take that I had always been interested in. So I started taking nutrition classes or nutrition training through the American College of Lifestyle Medicine. I did training on the integrative management of ADHD and autism through the Andrew Weil Institute of Integrative Medicine. And then all this time, that was in my professional life. In my personal life, I had become a vegan. I'd been vegetarian since I was in residency, like in 2004, and then became a vegan around 2018. And so learning about lifestyle medicine, very much I incorporated that not just into my professional life, but my personal life also. And I realized that the data was just so robust that as a doctor, I would be irresponsible not to share all this information with my patients about the impact of not just nourishment, but social connection, avoiding toxic substances, restorative sleep, mindfulness-based stress reduction, all those pillars of lifestyle medicine and all these integrative medicine principles that I had learned. I could finally integrate them. And ultimately, with a lot of my patients, I take care of very complex kids, PANDAS, autism, very complex kids. And ultimately, my goal is actually to unmedicate And so when I was trying to come up with, okay, how do I attract that type of family that, yes, absolutely. And I do prescribe medications. And I always tell families, I do prescribe medications. But ultimately, my goal is to give you the tools that we can unmedicate your child safely and with very close follow-up and with the absolute, we will pivot if we need to. But if we can unmedicate, I want to. And so when I was trying to come up with the little slogan of how to attract families who ultimately want to unmedicate, I came up with Veggies Over Pills, which was kind of a play on Forks Over Knives, which is a magazine that promotes whole foods, plant-based recipes and nourishment. So that's how Veggies Over Pills was born.
That's genius. So how did that work?
Really well. We do attract a very niche. I'm in Indiana, right? And I mean, I'm looking out the window at a cornfield that was just harvested. There's hay field over on this side. There's cows over on this side. The clinic's at my house. And yet I have families that travel from Chicago. They drive past Lurie Children's, University of Chicago, Rush, Loyola to come to us. I have families from Ohio that drive past Nationwide and Dayton Children's, and they come to us. We had a family that flew in from California.
My gosh.
To see me. And I think it's in part is our reputation, right? But I do think it's that my ultimate goal is to unmedicate. And I think a lot of families are looking for that. They don't just want pills. They want skills and other resources and other tools, and ultimately a doctor who listens. And I could not do this in the corporate world. The only way I can do this is because I am in the DPC world. And when I do meet and greets, I tell families, I don't have access to secret medicines or secret treatments that other doctors don't have access to. In fact, I would not trust a doctor who says, ooh, only I can do this test. Only I can do this treatment, right? I don't have access. What I have that other doctors don't is time. Is the time. And that's what DPC has allowed me to do, right? Is I have the time to sit down and review your child's records and review their case and review all the labs and then order more labs and review. We do a very detailed intake also. It's not just review of records. I have them fill out a lot of forms so that by the time I see them, I'm not trying to gather history, because again, the corporate world is so inefficient. Like the first time I meet the patient, I don't know anything about them. I'm just trying to like piece things together. And the way I've designed my protocols is by the time I do my first intake, I already know a lot about the family. So it really is more about clarifying, okay, well, the chart review said this, but your intake said this, and just trying to piece some things together, create an accurate timeline, and really go over treatment goals. What does recovery look like for you? And so I do think that it has worked in the sense that that name, the Veggies Over Pills, calls to a certain type of patient, and it's a type of patient that I want to work with.
Right. It's very direct. It's a direct call to the people that you want. There's no ambiguity about that one.
Ambiguity, right.
So that's great.
And again, then I have had people like, do you prescribe? I'm like, yes, of course. I'm a licensed pediatrician. I'm an evidence-based doctor. But ultimately, a lot of those medications are Band-Aids. And so ultimately I do want to get to, and I know a lot of physicians get triggered with the term root cause, but the root cause, and find out, okay, what is causing the inflammation? Is it the gut? Is it the immune system? Is it allergies? Is it celiac? Like those type of things.
Yeah. Well, that's fascinating. So when you opened Culver Pediatrics, did you already know that you wanted to work with PANDAS, all those kind of complicated things?
Not at all. It's funny because I set out to be like the small town country doctor, right? Like I wanted to be like all creatures great and small, but for pediatrics instead of
animals,
instead of veterinary medicine. I was doing house calls. Like I said, the clinic's at my house. Initially, all my patients were patients who followed me because I've been in the community for 5 years at that point. So they followed me. And then slowly we started getting some word of mouth patients. So no, I set out to be like the hometown country, small town country doctor that clinics at the house and does house calls and sees kids in the parking lot of the grocery store, like that kind of thing. And what happened was in late about 2, almost 3 years after opening, is we had our first Google family, what I call our first Google family, and they found us through Google. They Googled holistic pediatrician near me. I was actually an hour away from them, but that just tells you what of a medicine desert we live in. And we were doing one-on-one meet and greets at the time. I talked to the dad. I actually had no idea that the child had been sick for about a year. And I said, I don't know what's going on, but all I can tell you is my background. I'm a digger. I'm a diagnostician. And I will do a deep dive and figure out. And if I don't figure it out, I will help make sure I find someone who does. And so they joined the practice in January 2023. February 2023, I go to the first pediatric DPC mastermind. And Dr. Courtney West out of Pennsylvania gave a talk on mental health and behavioral health for the DPC pediatrician. And she talked about PANDAS. And I was like, oh my goodness. Now, at that point, I was seeing a lot of ADHD and depression and mental health because that's usually who gravitates towards pediatrics DPC. But at that point, it triggered a memory from when I was in medical school, because I went to medical school in 98. It was my first year of medical school. That's when the first studies came out. And I remember my professor talking about strep pyogenes and the complications that included rheumatic fever, post-streptococcal glomerulonephritis, and PANDAS. That was my training for PANDAS. And so I'm sitting here in this conference and I hear about PANDAS again after 20-something years. I'm in the conference, I open up my computer, I email the family and I say, I know what your child has. And we started the treatment algorithm from the PANDAS Physician Network. Dr. West very kindly guided me through my first patient, and she went into remission after her first dose of IVIG.
Amazing. I just got chills hearing that story.
It was amazing. And the PANDAS community is very tight-knit. They have Facebook groups. They have parent support groups. And from there, my name started spreading. And now we have a little over 30. And, you can take the girl out of academics, but you cannot take the academics out of the girl.
Yeah.
So I read a lot. And I learned from my patients also. I learned something new every day from my patients and kept an open mind, and also realized there's a lot of like money grabs and predatory certain test panels that are thousands of dollars that ultimately don't really change anything that we do. And so I do feel I'm able to at least guide families, okay, we don't need to spend $2,000 on the Cunningham panel. It's not going to tell us anything other than your child has inflammation, and I can tell you that right now that there's inflammation, right? So do we really need this very fancy and very impressive report that says, yes, cytokine blah, blah, blah is elevated? We really don't. So, but yeah, that's how it happened. It was serendipitous. And for me, it's been great because as an academic, I do like the challenging cases and the diagnostic dilemmas. And so it's filled that void that I was worried about intellectual stagnation. And so it has filled a void just intellectually for me, in addition to how it is a humbling experience.
Well, you can tell that you enjoy it. I mean, your face just lights up when you talk about it. So it's wonderful. I'm so glad for your patients that they find you. So how many kind of PANDAS patients do you have now, like percentage-wise of your practice?
We have about 120 patients, and at our last count, about 30, although that was a couple months ago when we did a count. So it's probably at this point, we probably have like 35. So most of my patients don't have PANDAS, but most of our new patients, definitely, it's for our PANDAS clinic.
So, is your practice, it's not closed, you're still open to new patients?
Yes, we are still taking new patients. Yes, we still take new patients. Yeah.
And are you advertising, or are you just kind of word of mouth?
It's interesting. And marketing is always something, we have these discussions in the DPC world about marketing. None of our paid marketing has ever given us any return on investment. So if there's DPC docs listening, I have spent disastrously expensive radio ads
Oh, yeah.
Print ads, Google ads, $9,000 worth of Google ads. We have, and no paid. Oh, there's a lifestyle magazine that local for our county that people pay like $10,000 to be on the cover. We did not pay that much, but yeah, it was like $3,000 for an article and nothing, zero. I did a radio show for a while. The paid marketing here has zero ROI, zero investment.
Yeah.
So the way we market first is we provide amazing care.
Absolutely.
Right? And so word of mouth is one of our main marketing. Is the other is we do have a very active social media and web presence because especially since people from the Facebook groups talk about us. And I still consider that word of mouth because even though the word is happening in social media, it is still one person telling another person about
it's
us.
organic.
But then they go to our website and our social media for the vibe check. And then from there we're very digital and very automated. And so they can schedule a meet and greet directly from our website. And then all that process is automated. So we market in that sense. We still do social media. We're very active. My daughter actually does our social media.
Oh, that's great.
And so, yeah, it's a post every day on Facebook and Instagram. And then our website is very active. I keep a blog for SEO mainly. I mean, nobody reads it, but we use it, number one, for SEO because Google detects that, like how active is the website? When was it last updated?
Right.
And so yeah, those are the kinds of things you have to think of as a DPC doc. Either you have to think about it or somebody else has to think about it because your website isn't active. It's not going to pop up on the search engine. Reviews, we ask for reviews. So all of our reviews are 5-star right now. So that's also a marketing in the sense that it's Google, right? It's playing the Google game. But yeah, the reviews have led us to more patients than the disastrously expensive Google ads. But then I hear docs from other markets that say that Google ads have yielded them a lot of ROI. It just every market's different.
Right. I think it is very area specific.
Very area specific. Here with being rural and being such a niche demographic, it's word of mouth.
Yep. Yeah, definitely. Well, I wanted to talk about things that you do outside of your regular practice, because that's what we talk about on the podcast, DPC stuff in the office and also outside. So whether it's things like non-medical or just whatever your passions are. So tell me about your women's retreat.
Yeah, so that was a passion project. Yeah, that was a passion project. So I'm going to get a little personal here. In 2023, so I had already been open for 3 years at that point. I got a phone call that from my sister, or one of my sisters, that my mom had a stroke. And it was a shock because she was 79. She was months from turning 80, but she was healthy. Like, she walked 3 miles every day. She lived independently. She cooked, she baked. That the day that she had her stroke, she went on a power walk for 3 miles. She led a Bible study. She had lunch with her friends. She baked cookies and she worked in the backyard. We were able to piece all of that from the Ring camera. And so she'd had a stroke. And so I flew down to Texas, and 6 days later she succumbed. And during that time, while I was literally in the ICU watching her die, I was sending refills, answering texts, doing telehealth from the bathroom in the hospital. And in the aftermath of processing all that trauma, I realized that what had led me to that point was some internal pressures, right? The people pleasing. I'm the firstborn daughter of immigrants. People pleasing is my drug of choice. So saying no is really hard for me. I've gotten better about saying no, and I actually can say no, but I still feel really bad about it. And I'm still working with a mindset coach about that. But I realized that I had to overhaul both my personal and my professional life. Around that time, I came across 2 studies, one from 2022 that showed that patients and staff send female doctors more messages through the portals, 25% each. So depending on the size of the panel, that could be 60 messages or more. A 2025 study that patients are more likely to send female doctors demeaning or negative messages. And then another study that was very eye-opening. While in the general population, women outlive men, and not for female physicians. We don't have that longevity benefit with our male doctors. And so learning all of that, learning what I'd learned from being in practice at that point for about 3 years, and trying to heal from the trauma of not just losing my mother, but what had led to me being in the ICU, and instead of being fully present during her last days, doing these things, right? Like answering, like still working, even though I was the boss, like literally this was me, right? This was me. I came up with the idea of a retreat. Actually, I was in the mastermind, in the second DPC mastermind, and I mentioned something about how we would do retreats for moms of children. And one of my colleagues, Deanna Berry, she was one of the participants, and she coordinated the DPC mastermind. She said, "You should do this for us." And I went, "Got it, girl. We'll do it." So we had our first retreat September of this year, September 2025. It was such a powerful experience to have a group of all DPC women talk about things that nobody else in the world understands. And not even our male colleagues, right? Because again, patients treat us differently than they treat male DPC doctors, right? They have different expectations. And so it is more important for us as female doctors to establish boundaries, to establish processes and protocols that protect us. That one of the things that I talked about in the retreat was dare to click less and care more, which is delegate, automate, renovate, or eliminate, so that you're protecting your energy and your bandwidth as a female DPC doc. And the retreat had all the fingerprints of a Noemi thing, right? So all the food was whole foods, plant-based. We did yoga every morning. We had meditations at night. So it was just really fun for me to do something that was non-medical, healing, empowering, and just brought together this community of women that really, there's no one else in the world that understands what it's like to be a female DPC doc than other female DPC docs.
Yep. Yeah, I hear what you're saying. I think it's wonderful. And I think a lot of people are feeling that. And that's one reason why I love the DPC Women's Facebook group. It is a safe space and everyone understands what each other is going through, even if you have a different kind of practice, different style, different size, all of that. But there are still some things that are very universal for women DPC doctors.
Right. And I do think that there's some things that I would not feel comfortable discussing in the general group. For example, pricing, right? You know, as female doctors, we do have to think about pricing differently because we do have to keep smaller practice sizes, I think, than our male doctors. There's just a different expectation. There's just a different, I think we attract a different population. I do think patients make more demands of us. And so so those are the external pressures, but the internal pressures, and this is studies show female doctors have better outcomes. And this is across multiple specialties: surgical, inpatient, and primary care. Female doctors have better outcomes for patients that are treated by female doctors amongst all these specialties or all these fields have better outcomes. But what it takes to have those better outcomes is we spend more time with patients, we interrupt less, we are more likely to adhere to evidence-based guidelines, we spend less time, we don't interrupt as much. So, but all those things take time. And the system, I mean, talk about why a lot of us are burning out in the system. The system does not reward that type of practice, right? The system rewards the way males doctors practice, which is quick, right? Quick. And please, no disrespect.
Right.
I have great respect for my male colleagues.
Right. Yes.
Right. But, you know, this is what the studies show. I just felt as female doctors, specifically female DPC doctors, and I love the Facebook group, to be able to have these discussions without fearing judgment or from other people who feel the same way or have that level of experience is just such a powerful thing. So we are going to have another retreat, same thing. It's going to be September 24th through the 27th in Culver, Indiana. So if you're a female identifying DPC doc, I hope you can join us.
2026. So a little less than a
less
than a year. Yeah, I know. What year is it anymore?
I know.
Yep. So yes, we actually, and I don't know if other states have this, but in North Carolina, actually the woman I interviewed for my episode last week, Dr. Catherine Locke, she's in Asheville. She started a women's monthly DPC group on Zoom.
Oh.
And it's been really good.
Yeah,
really good.
I'd be interested in that.
Oh, you can do this too.
Community is so important. Yeah.
So yes, it's just very simple. It's a Zoom call. You send out the invitation. It's the first Friday of every month. You drop in if you can. If you can't, next time. And she will have a topic every month. She moderates and kind of facilitates the talk. And it's just really nice because it's a great mix. It's established new practices, people who are thinking of joining or opening a DPC. It's a great experience for everyone. So yeah, if anyone else is listening and thinking about it, it's really easy. You just need a Zoom account and just reach out to your, kind of statewide doctors, and it's very easy to start. I think most states have some sort of Facebook group for the state.
Right. Mm-hmm. Yeah, I am part of the Indiana State Medical Association. So, and we actually just got approved for CME through them for the retreat.
Oh, fantastic.
So we will be offering CME for the retreat. And I had actually been thinking about having a DPC Women's Cafe, basically, getting together and talking about, and yes, I think doing it state specific is a great idea.
Mm-hmm, mm-hmm. Yeah, I think it's also good. Yeah,
there are a lot of state specific issues when you're opening up a business.
Yes, true, very true. And I know some people, I think Dr. Adriana Rouse tried, I don't know if she's still doing it, but she was having kind of coffee chats, except she's in Michigan, and it was kind of a nationwide thing. And so the time difference makes a difference too. A lot of people couldn't make certain times because, of course, the differences.
Yes, no, that's a great idea. Yeah, in Indiana, we're either Eastern or Central, but, there's not that much of a difference between. You could make it early in the morning, for example. Mm-hmm. And
yeah,
that's a good idea. Yeah, no, that's a great idea.
Yeah, well, I appreciate you coming on. Is there anything that you would like to tell the listeners in particular that you haven't already?
Oh, let's see. If you are interested in opening up your own DPC practice, I will say, the one thing I wish I had known before is I wish I had set up my practice when I had 5 patients and the same systems and set the same expectations for my patients as if I had 100, yes. 200, 500 patients. So once again, though, that internalization of wanting to please. First, I was answering text messages within seconds and sending refills within minutes, and that is not sustainable. So as you get busier, you're not able to do that. So your patients can be disappointed, right? Be dismayed that, well, but wait a minute, you used to answer right away, and now I'm talking like I used to answer within minutes, and now it takes me like a few hours, right? It's still beating any metric, any other doctor in the area. But when your patients did have a certain expectation, we have had to retrain. We have had to retrain our patients. And fortunately, most of them love us. They are absolutely understanding, and it's not a problem at all, right? But it was hard to have to retrain our patients, right? So I tell all new doctors is, okay, get an EMR that you can pre-schedule responses for later, even if it's just a few hours later, but you're not answering right away. That way you're still addressing it, right? And so it's out of your headspace, but the patient doesn't actually get it until a few hours.
Sure.
Or set expectations that even though, yes, you can send that refill at that moment, don't send it for another 24, 48, 72 hours. Set the expectations and the processes early on, not just for when you have 10 patients, but when you have a full panel. I do wish I had done that.
Yeah, that's wonderful advice because that does protect your time, it protects your boundaries, protects your time with your family. And so I do the same thing. I tell people to think about, if you only have 5 now, what about when you have 100 or 200 and it's winter and is sick and they want to see you? What do you do then? So you have to start the way you want to finish. So, yeah, it's really important. And you have a lot of automations and things in place now.
Yeah. And I wish I had. But you know what? Honestly, when I first started 5 years ago, a lot of these things didn't exist. They didn't exist. So you kind of hodgepodge Calendly and MailChimp. And then you realize, okay, this isn't doing what I need it to do. Oh my goodness. Now they're like all these options, but they're beasts. They're beasts trying to manage. But yeah, the other thing I'm a big fan of besides automation is group meet and greets.
Ooh.
We do group meet and greets. We don't do one-on-ones.
That's something I had not heard of.
Yeah. Oh my goodness. I encourage people to do that because meet and greets, first of all, it does create this opportunity that a lot of people will just want to tell you everything, right? Their entire medical history. So it does prevent that, but it also prevents you from repeating the same thing over and over. We don't take insurance and this is my background or whatever. And it doesn't take your time away from your patients. So, but yeah, we've been doing group meet and greets for, my goodness, over a year now, and it's worked very well.
How often do you do that?
Once a week, Mondays at 5. And that's the other thing. It also sets the expectation from the beginning of, if you want to talk to me, if you want to meet with me, you need to adjust your schedule. So Mondays at 5 o'clock, and the link is on our website. And we tell people this is Dr. Adame's availability. And so I do think that also sets an expectation from the beginning.
So they schedule for that time? Is that how it works? Okay.
Yes. Yeah. We, up to 10 people can schedule for one meet and greet. And the link is all over our website. And if they go to our website, and so that's the other is, we're pediatrics, so our families do tend to be younger. But yeah, our families need to be pretty digitally savvy. And the way we filter that is, you want to schedule your first meet and greet or consult, go to our website and schedule it there. So that kind of helps weed out the people that are digitally savvy.
Right. Oh, that's great. That's a wonderful idea. I appreciate you coming on. It's been so nice talking to you and hearing about your practice.
Goodness, yes, it was nice talking to you too.
Thank you for listening to my episode with Dr. Noemi Adame. I hope that if you are a physician who's been feeling rushed and morally injured by corporate medicine, you realize that other people have felt the same way and that you are not stuck. So if you are a woman physician who is thinking about moving into the DPC world and you want to talk about this with other physicians who've done the same thing and discuss boundaries, systems, money, and your identity as a physician and an entrepreneur, that is exactly what the DPC Women Connect event is for. It is happening this February in North Carolina. If you want details, DM me Connect on Instagram and I will send you the link. If this episode helped you, please follow the show and send it to one colleague who needs to hear it. Thank you for being here, and I will see you on the next episode. Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you. This show is brought to you by DPC Ads in Minutes and Harmony Obs Health, helping independent doctors like you grow and thrive.